Good evening, ladies and gentlemen. I'm Steve Manelski, and I'll be your host for Valley Veterans Forum. As the title implies, this program will be about and for veterans and for active military and their families who will one day become veterans. It's not difficult to see that veterans and active military families face additional challenges due to the military lifestyle. Long and multiple deployments away from home, financial and emotional family strains back home, or consider veterans whose entire civilian lives have been forever changed by war's after effects. Maiming or crippling injuries, post-traumatic stress disorders, violent antisocial behavior, or perhaps the resort to suicide. The goal of Valley Veterans Forum is to be both topical and informative. We'll strive to keep you apprised of the benefits and entitlements available to you through federal, state, and nonprofit organizations. We'll feature guests who will share their personal military experiences and the impact those experiences have had on their post-military lives. And we will seek to spotlight experts who are at the forefront of efforts to treat some of war's tragic aftermaths. My guest tonight is Dr. Hani Raoul Khouzam. Dr. Khouzam is a prominent authority on the diagnosis and treatment of post-traumatic stress disorder, otherwise known as PTSD. He holds a medical degree from the Cairo University Faculty of Medicine, a master's degree in public health cross-cultural psychiatry, and received his psychiatry residency training at the University of Oklahoma. He is board certified by the American Board of Psychiatry and Neurology and a fellow of the American Psychiatric Association. He is a staff psychiatrist for the VA, having served at the Oklahoma City VA from 1990 to 1992, the VA Medical Center in Manchester, New Hampshire for 8.5 years, and at the VA Central California Healthcare System here in Fresno to the present. He is a health sciences clinical professor of psychiatry at the UCSF Fresno Department of Psychiatry and an author of numerous books dealing with emergency psychiatry, depression management, and the diagnosis and treatment of post-traumatic stress disorder. Dr. Khouzam, we hear a lot about veterans returning from Iraq, Afghanistan, and other places, and that they have PTSD. Could you tell us, what is PTSD?
So PTSD stands for post-traumatic stress disorder. The word post means after. So after a person experienced, witnessed, or lived a traumatic event, they keep experiencing the stress of that event as if it just happened. It may have been happening 50 years ago, 40 years ago, 3 years ago, but the person still experiencing it with all its stress as if it just happened today, which affect all the aspects of their life.
Could you tell us a little bit about the history and statistical evidence for PTSD?
We think that PTSD has existed since humanity began. There are actually accounts that demonstrate that some biblical characters have developed PTSD. For instance, David, Moses, Joseph, even some of Jesus' disciples like Peter and Judas had PTSD. But if we push in history, we know that some of the characters that have been portrayed in the Greek myth of the Odyssey and the Iliad have had PTSD. For instance, Achilles, which is the famous character in the Troy War. If you study his life, he has all the symptoms of PTSD. Then we move forward. Civil War veteran have had symptoms of PTSD. World War II veteran. However, we did not know that they have this condition, so we called it different name. It's not until 1980, because of the plight and suffering of the Vietnam War veteran who returned home with multiple symptoms that did not fit any known diagnosis. So when they studied them, the American Psychiatric Association in 1980 published its book and mentioned this condition is called post-traumatic stress disorder, which make it a legitimate condition that require accurate diagnosis, treatment, and management.
How do we diagnose PTSD?
So a person, in order to have PTSD, has to have experienced, witnessed, threatened, or being told of a traumatic event. As a result of that traumatic event, they start re-experiencing it. Now, re-experiencing doesn't mean just remembering it. Re-experiencing means reliving it over and over again. As a result of that re-experiencing, the person decides to avoid anything that can remind them of what happened. So they may decide to, in the extreme case, actually avoid living or interacting with others. Also, the condition leads to lots of physiological disturbance that affect sleep, for instance, in the form of nightmares. It can also lead to mood fluctuation in the form of irritability or depression. And also it can lead to what we call hypervigilance. The person is on the alert 24 hours a day, watching, not trusting the crowd. In other words, they cannot live an easygoing life. They think they are on the alert 24 hours a day. And what happened then, some of them also start to think that they don't have future. So some of the patients who suffer from PTSD also have a condition called survivor guilt, which haunt them for the rest of their life. I have to mention that because of the Vietnam War veteran, we discovered PTSD. The whole world know this condition. It doesn't have to happen just in combat. It can happen in a little boy that is abused, a lady that mugged in the elevator, a survivor of an accident or a natural disaster. This is a condition of humanity, not just combat veterans.
And how do we treat PTSD?
Okay, because PTSD affects the person as a whole, it affects their biological being, or what we call their physiological well-being. So we have to treat it biologically. And when we mean biological, it means we can treat it with medication. This is also a psychological condition, so we need to treat it psychologically, and that's what we call psychotherapy. It is also a social condition, so we have to treat it socially, meaning not just treat the person, but treat them with their significant other, their family, their children. This is also a spiritual condition because of the survivor guilt. and the sense that life has no meaning, this condition also needs spiritual intervention. So we treat it bio, psycho, socially, and spiritually.
Do people with PTSD have other medical or emotional problems?
Yes, thank you for asking this. First, it's important to know that not every person who experiences a trauma will develop PTSD. We think there are risk factors for developing PTSD. Some of these risk factors are medical, like if somebody has a medical condition that is not treatable, or if somebody abuses alcohol or drugs, or if somebody has had a head injury, or if somebody was abused as a child. These are conditions that were present before they develop PTSD, and they can remain with the person after they develop PTSD. In addition, a person who already developed PTSD can develop or have other psychiatric conditions. For instance, they can have depression, they can have anxiety, they can have sleep problem. So it's important when we diagnose somebody with PTSD, we don't think that our job is done. We have to know, do they have PTSD and something else? Because treating PTSD and the other condition improve both conditions. Treating one condition and not taking care of the other make both conditions worse.
What is your final message to all of us regarding post-traumatic stress disorder?
I want to tell people who suffer from post-traumatic stress disorder, do not consider this as a shameful condition. This is not a leprosy. This condition is an opportunity. In other words, a person who has PTSD, no matter what their suffering is, this suffering can be turned into an opportunity for a change for the better. I'll tell everybody with PTSD, please do not fight it. Accept this as part of who you are. It made you this unique person that you are, and you wouldn't trade anything in life for it, and use it to install hope, future, and creativity.
Dr. Khouzam, could you tell us about PTSD?
Yes, sir. I'm going to demonstrate some of the aspect of PTSD through this slideshow.
Okay.
We'll go over some important part of this condition. Yes. So this is very important to understand what is the biological part of PTSD. You see, as you see in this slide, when we experience any amount of stress, before we react, the stress has to go to our computer, which we call the cortex. Then this cortex that you all saw is going to decide, do I need to react or not? If I need to react, it sends a message to the amygdala. Then the amygdala produces the reaction. That's what happened in normal condition. See, go to the cortex, get permission, send the message to the amygdala, then I avoid the accident. As you see, the response is what the amygdala gives the order to do. Now in PTSD, something else happened. So if I show you this slide again, in a person who has PTSD, see what happened when the stress occurs. So if you please show me this next slide, and it will show you what happened in PTSD. Okay, this slide talk about, we have hormones in our body that are supposed to moderate how we react. So for instance, we have this pituitary gland. It secretes thyroid hormone. When we don't need thyroid hormone, the pituitary gland tells the thyroid, I don't need thyroid hormone, or I don't need cortisone. So it sends a feedback saying no more hormones. In PTSD, apparently the opposite occurs. This feedback loop is not working. So it keeps either secreting or not secreting the hormone we need. And that's why the person have anxiety, sleep problem, irritability, because the feedback say, I need more, or it say, I don't need any. So as you see, there is a disturbance. People have compared this to a symphony. Can you imagine if the symphony play a piece of music without the maestro? The musician will be the best musician, but they will not be able to play the symphony. Why? Because the maestro, which is our pituitary gland, is going to tell the leader of the orchestra, now it's time for the violin to come, it's time for the drum to come. And in PTSD, the drum, the violin, everything works out without the maestro. This slide here summarized the criteria for PTSD. So you see, as a person have to have a trauma, re-experiencing, try to avoiding. See, like you see, trauma, re-experience, avoidance. As a result, the person is unable to function. These symptoms have to last more than 1 month, and it associated with increased arousal and automatic reaction of hypervigilance, nightmare, and there is the associated feature of survivor guilt. So these are the diagnostic criteria for PTSD. There is the part of how do we treat PTSD. Like we said, you can treat it with psychotherapy. And these are the type of psychotherapy that have been used to treat PTSD. And they've been very effective. And one of the most important treatment is cognitive behavior therapy, exposure therapy, and EMDR, which is eye movement desensitization reprocessing. This is a controversial treatment. Some authority advocated for treatment, some do not, but some veterans benefit from it. The other part of treatment besides psychotherapy is the pharmacological treatment of post-traumatic stress disorder. Before you treat people with post-traumatic stress disorder, this slide shows that psychoeducation and counseling is very important. Educating people about their symptoms, make them feel that they are not really out of touch with reality. They are not crazy. They are not lost their mind. Educating them about the condition, make them understand why they have certain symptoms. And by educating them, it gives them the motivation to seek help and treatment. Which I covered about exposure therapy and cognitive therapy, I encourage anybody who suffers from post-traumatic stress disorder to really give psychotherapy a chance. Psychotherapy is not mind control. These are therapy that has been studied and proven to be effective. This is what we call evidence-based treatment. And the word evidence-based means all the study conducted on psychotherapy for PTSD, which are controlled double-blind study, were summarized in what we called meta-analysis through a computer. And if the meta-analysis say this therapy is effective, this is what we call evidence-based. So these two types of therapy have proven to be evidence-based to treat PTSD. Now, cognitive behavioral therapy, the idea of cognitive behavioral therapy is any symptom that come as a result of feeling, before you act on your feeling, try to reverse the feeling by thinking differently about it. In other words, if I have PTSD and I think that my neighbor looked like the person who abused me as a child, before I react based on my feeling, can I correct my thinking and identify this gentleman is not the person who abused me, so there is no reason to act on my feeling because I corrected my feeling by changing my thinking pattern. That is the basis of what we call cognitive behavior therapy. Emotion will be changed by thinking the thinking, and as a result, the behavior will be changed. So that's the model of now medication, which we call psychopharmacology. These are the name of the class of medication that are used to treat PTSD. The first class, which we call SSRI, these mean serotonin reuptake inhibitors, and the FDA has approved 2 medications from this class to treat PTSD. The first one is called sertraline, and the trade name for this medicine is Zoloft. And the second medication is called paroxetine or Paxil. These are the only 2 medications that the FDA has approved to treat PTSD. However, the rest of these medications that you see on the screen have been used to treat PTSD, although they are not approved by the FDA, because not every person who have PTSD has the same symptom, even if they are identical twins. So if a person does not respond to a medication that is approved, we cannot give up on them, and we can give them other medication that have been used in several trials and showed that these medication can help in relieving the symptom of PTSD. So that is the list of some of them. Now, I don't know that that slide is not clear. What it said, I don't know if the color can change, but anyway, it's just give you the name of each medication in its trade name and generic name. But that's just a summary of the previous slide. Now, I'm very impressed that even before our advance that we have now with all our technological research and biological study, that Plato, long time ago, said, we do not treat diseases. We may make error by saying, I'm going to treat PTSD. We are not treating diseases. We are treating people who suffer from diseases. Remember, human beings are not just illnesses. If you want to improve the life of a person who suffers from PTSD, you want to know who they are, not just what they have. The treatment of PTSD is also knowing who is the person that is suffering from it. Let's not forget that and get sidetracked in just we are treating diseases. So I'm glad that Plato told us that long time ago. Now, this is a very important part of PTSD, which is the spiritual part. If you are told throughout your growing up, thou shalt not kill, and you go to war, or you try to defend yourself from somebody who's trying to kill you, and that other person die, how can you live with that? So I want to really clarify this commandment, if you translate it accurately, should say, thou shalt not commit murder. There is a big difference between murder and killing someone in combat or in self-defense. So what happened? The person started to lose their spiritual belief, saying, how can God or how can the Creator allow children to be massacred or ladies to be raped? It must be no God. So people with PTSD start to lose their spiritual anchor. When you lose your spiritual anchor, life becomes with no purpose. Life loses its meaning. And the intervention to bring people back to their spiritual life is the spiritual intervention, which requires acceptance, forgiveness, and knowing that through commitment, forgiveness, and acceptance, there is spiritual life despite PTSD. And these are two examples that William Shakespeare has demonstrated to us. The case of Lady Macbeth, after she killed her husband so that his brother become the king, she kept seeing blood on her hand all the time, although there was no blood. That is a symptom of PTSD, reliving the experience. The best doctor of Shakespeare time told Lady Macbeth, your illness cannot be cured with physical intervention because this illness lies within your soul, and that's why it requires a spiritual healing through commitment, forgiveness, and acceptance. And because we are addressing our veteran, I want to tell them first, thank you. Because of your sacrifice and your suffering, we discover PTSD. PTSD is not the end of your life. PTSD is a step for a better life, because PTSD can be an opportunity to what we call post-traumatic growth, turning a trauma into post-traumatic growth, make you resilient. It increases your spirituality. You become a role model for everybody who suffers, as opposed to the negative effect of trauma, which make you lose your faith, and you lose the meaning of life, and you lose the purpose of life. So you go into substance abuse, destructive behavior, multiple marriages, losing jobs. All these things are not needed because you have PTSD. You will be healed through your spiritual renewal. And I hate to repeat it, but I have to repeat it again. It comes through commitment, forgiveness, and acceptance. Now, society does not believe in spiritual intervention. Create these superheroes. And if you like Superman, if you like Batman, if you like Spider-Man, study their life closely. All these suffered from post-traumatic stress disorder. They turn the trauma into an opportunity. We call their superhero. Why? They are not focused on themselves. They turn their suffering and trauma into a power to help and rescue and let people know, I've been through it, but I'm not going to let it end my spiritual life. I am here to turn my trauma into an opportunity to help and rescue others. These are our superheroes. If we look at them, they're actually spiritual heroes that turn their trauma into an opportunity for post-traumatic growth. So, I just summarized these to let you know spiritual healing and post-traumatic growth will happen. And it's not by might, not by power, but by the Spirit. And that's the part of our human being that nobody can take away. Our spiritual life cannot be taken away from us. Hopelessness, helplessness, despair try to rob us from our spiritual life. So I encourage all of you, veteran, you have gone through the hardship and the suffering. This is your opportunity for spiritual life and renewal. And that's just summarize that if PTSD goes through the route of anger, resentment, bitterness, hopelessness, a person may be living in their body, but they have a spiritual death. If the route of PTSD goes through acceptance, forgiveness, healing, then you have a spiritual life.
Doctor, I want to thank you very much for coming in tonight and telling us about your specialty, PTSD. And I hope to invite you back again in a future program to talk about some of the other problems you are treating.
Thank you, sir, for inviting me. I've been honored and blessed by this opportunity, and I hope it will help whoever watch it. Thank you so much.
Thank you, Doctor. And thank you all.